COVID cases hit record highs in Texas. The increase is putting new pressure on healthcare workers.
As we gain patients, we're losing staff. Bad combination.
The growing concern and why the governor says next week could bring good news for doctors and patients. Texas law requires nurse practitioners to work under a doctor's supervision. We investigate why many are now pushing to work alone. Texas students lacking technology for learning from home. How electric co-ops are helping fill the gap. Pandemic pass or fail, solutions for education equity coming up. Hello and thank you for joining us for State of Texas. I'm Josh Hinkle and today I'm joining you once again from my home studios as our crew continues to social distance amid the coronavirus pandemic. Texas set new daily records for the number of new cases over the past week. The state is also seeing more patients in hospitals, and that's putting a strain on caregivers. Wes Rappaport looks deeper at the challenges facing healthcare workers in different parts of the state.
Even on Friday when she passed away, she sent me a text in the morning and I responded, but she never saw it.
Parkland High School teacher Natalie Reveles is one of more than 700 people in El Paso who died after contracting coronavirus. Some funeral homes there rolled out mobile morgues to keep up with virus-related deaths. Closer to the Panhandle, Amarillo hospitals are overfilled.
The numbers of the hospital are scary.
And understaffed. Northwest Texas Hospital has more than 100 staff in quarantine due to possible exposures.
As we gain patients, we're losing staff. Bad combination.
Our healthcare community is taxed beyond anything that they've ever been stressed before.
Amarillo's COVID-19 hospitalization rate has soared to more than 30%. Down the interstate in Lubbock, local hospitals are standing up tents to serve short-term patients. Their hospitalization rate has been above the 15% threshold set by the governor to determine business capacity for more than 3 weeks.
We're very full.
And the boost in resources for western counties is beginning to cause problems for other regions. Austin's public health authority says his community's got the supplies needed, but is short on staffing.
Why can't we get those people? Because those people are in El Paso, and those people are in Lubbock, in Amarillo, in Dallas. They're in other states around the country.
Amarillo's mayor pleads for patience and cooperation.
Please be the leader that can step up and postpone your event, delay your event, meet virtually for a few more months just to help control the population of sick people going into our hospital.
I'm Wes Rappaport for State of Texas.
State health and emergency management leaders have surged medical supplies and additional healthcare workers to West Texas in the last month, and Governor Greg Abbott says more help is on the way for doctors and patients.
This is really promising news, and that is as soon as next week, we're going to have new therapeutic drugs that will be able to treat people who have COVID just like the president was treated. The first one is being issued by Eli Lilly. The second one that will be coming out a few weeks after that will be the Regeneron drug, which was the drug that was taken by the president. Bottom line is, even before vaccines become available, we will have these therapeutic drugs that will be able to treat people who get COVID and improve them, and that will reduce the people with COVID, it will reduce hospitalizations, and it will reduce fatalities.
Governor Abbott says Texas is ready to distribute the COVID-19 vaccine once it becomes available. He said that frontline healthcare workers, first responders, and senior citizens will be the first in line to get the vaccines.
She absolutely loved music. She loved Yo Gabba Gabba. Sing and dance and play. She was learning to ride her bike before she passed away.
Betty Wattenberger died last year from flu complications. Her family says she was treated by a nurse practitioner at an urgent care in North Texas who did not have enough training. They insist patients see a doctor, especially during the pandemic. It was one of our most talked about investigations. Who should treat you? In Texas, nurse practitioners can treat patients as long as they're under a doctor's supervision, and now there's a renewed push to allow them to practice independently. As investigator Arzo Dost explains, they hope to fill a gap which the coronavirus surge is exposing, especially for those in rural areas of the state.
Hello, how are you today? We're following up with you today regarding your recent hospitalization.
Joanne Cabello is here for a checkup after a fall. She's been coming to Ferguson Family Practice in San Marcos for years.
I don't know where I would be at
if I had not come here.
The 66-year-old, along with her entire family, is treated regularly by nurse practitioner Ashley Ferguson instead of a primary care doctor.
We're going to print out the last office visit on this patient.
A nurse practitioner is an advanced practice registered nurse who has extra training, education, and certifications.
I see both insured and uninsured patients. But, you know, I have a pretty large population that is dependent upon Medicaid, and a lot of these patients do not have alternatives in this area of people to go to that are open to you know, taking new Medicaid patients.
Ferguson opened her clinic more than 5 years ago. She can do that under Texas law as long as she works with a supervising doctor. Hers is in San Antonio, and that oversight comes with a price. The Texas Nurse Practitioners Organization says a recent survey shows that nurse practitioners are paying supervising doctors between $1,200 to more than $87,000 a year.
We discuss, you know, cases as needed. He does review charts for me.
Texas law says the supervising doctor can be anywhere in the state and must meet once a month with the nurse practitioner to review charts. Right now, nurse practitioners can't prescribe medication, including narcotics and depressants, outside of the hospital and hospice settings, and they can't sign death and birth certificates.
There's a lot of paperwork that depends upon, you know, we can't sign, my collaborating physician has to, and so that can delay care for people.
Access is an issue for a lot of people. The further remote you get, I think the more it is.
David Bushnell is also a nurse practitioner.
We are the ER coverage. We are the rural health clinic coverage.
He works at the only hospital in Big Lake in West Texas. It's a 4-hour drive from his home in New Braunfels.
When I'm at work there, there's been 2 doctors and a nurse practitioner that work during the week. There's another nurse practitioner from Abilene that's there when I'm not there, as I work every other week.
State Representative Donna Howard, a former nurse, pushed a bill last session that would have allowed nurse practitioners to work independently after more than 2,000 hours under a doctor's supervision. It would have also meant that nurse practitioners could perform and interpret diagnostic tests, formulate medical diagnosis, and manage chronic diseases. The bill didn't make it out of subcommittee.
You know, I think that the pathway may be a little different now with our experience with COVID and the recognition of the lack of adequate provider care for Texans, especially in our underserved areas, in our rural areas where we've seen hospitals close, clinics close.
More than 30 states have moved to allow nurse practitioners to work independently, most recently California and Florida. Half of those states say nurse practitioners can open their own practices after physician oversight for a set number of hours. Nurse practitioners are hopeful Texas could be next, but some doctors groups say they don't have enough training to practice on their own, and that puts patient safety on the line.
If you want to function independently and make all the decisions, and with that comes great responsibility, you need to have the level of training to do it safely and responsibly.
Dr. Ari Brown is a pediatrician in Austin. She's also a member of the Texas Medical Association, which advocates for physician-led team care for patients. She says nurse practitioners play an important role, but their level of training makes a difference.
I gave up a decade of my life to become a doctor. If you want to function as a doctor, go get the training to be a doctor.
Dr. Brown says they especially should not be providing care in rural areas.
That's probably the worst choice you could provide, is providing suboptimally trained people for a community where you don't have backup.
Their hemoglobin A1C is less than 7. We have a lot of training, and if anything we feel like is beyond our scope, we refer. I mean, there's never a hesitation on my part to refer when I feel like something's beyond my scope.
Ferguson says it comes down to access to care for patients who already have limited options, especially now during the pandemic.
She's kind of like family now. I trust her totally and completely.
Arzo Dost for State of Texas.
Just last month, Governor Abbott proclaimed Nurse Practitioner Week in Texas. His proclamation says nurse practitioners are invaluable members of Texas' healthcare community and uphold the standards of excellence of the Texas Board of Nursing. As Arzo mentioned, California is now the latest state to allow nurse practitioners to work independently. It's why Physicians for Patient Protection is already talking to lawmakers in Texas to make sure it doesn't happen here. They say nurse practitioners need stricter requirements than what the state allows now. They also dispute studies that nurse practitioners point to as their safety record. You'll find those studies and can explore what medical shortages Texas is facing, especially during the pandemic, online now. Just look for this story in the Texas Politics section of this station's website. Making money from marijuana. Why some state lawmakers believe now is the time to make pot legal in Texas. President-elect Joe Biden promised big education reforms, why some question whether the changes will reach Texas public schools.
What is it that the schools need and what can we do to help them?
Help to keep students from being left behind amid the pandemic, how rural electric co-ops are working to provide internet to students and schools in need. Pandemic pass or fail, solutions for education equity coming up.